We are still in the morning. Good morning. Let's have some energy in the room. We are going to take a little back step and broaden our perspective on maternal care with this very enlightened session which you are going to witness for the next 40-45 minutes. We are not going to be very clinical. We are not going to be totally non-clinical. So we'll be talking about masses rather than an individual patient and a provider. So let's hear, the answers from a very diverse panel which I have. They are distinguished and very dedicated to their profession. Mind you, they'll be speaking a lot about their personal experiences and what they are doing in their business so that, we are all able to get good information. As you know, we are not talking about institutional care now as we used to talk about two decades back in India. We have 98% institutional births now. Previously, about two decades back, it was like 50-60%. There were many home deliveries. So all those we have passed, but there are still a lot of challenges. We have not yet done a very good job on continuum of care for maternity and postpartum and, lactation and support and all that. Also, I get a feeling as a public health expert who works with Government of India to finalize national policies that we are still very, very fragmented. Clinicians do not talk to lactation support system, do not talk to the NGOs, do not talk to the other, civil society members, because we should be talking about family as a unit here. The woman is not simple. She lives in an ecosystem. There's a family. And I personally feel as a family medicine practitioner that if we take family as a unit, I think we'll be able to provide much better public health and much good health, positive health to the citizens of the country. Now, there are very basic questions which I'll be asking each one of them one by one. I would request the panelists to be, simple and brief so that, because we have a mix of audience. We have doctors, we have nurses, we have common people also. We may have some mothers also, pregnant mothers. So what we should be talking about should be sort of serving all their purposes. So thank you very much. I will first go to Dr. Deepti Arora. She is a founder, member of Everbliss, Maternity and Family Wellbeing Leader. She is a lactation consultant, child nutritionist and postpartum care professional working to strengthen families through preventive and evidence-based care. So Dr. Arora, my first question to you is from your personal experience of the kind of work which you are doing, what are the common breastfeeding challenges new mothers face in these early days and how they can be addressed through timely support? Over to you.
Thank you, sir. So, what I think that breastfeeding is not the system that where the mother struggles a lot because she don't know, but she struggles because she's not prepared or supported. And inside of that, what we daily used to see in our practices is that the major challenges what she comes through is the pain due to incorrect latch is the highest one, and the second is there is a fear of low milk supply, or there is a delayed initiation of breastfeeding after the childbirth, or there is emotional overwhelmment a lot, right? So I do believe that, breastfeeding doesn't fail because she doesn't know that, but the gaps in guidance is there so much that she feels that I don't know how to do the simple thing. But if there is a timely support and early support, the breastfeeding can be a joyous experience for all the mothers. Breastfeeding, I again say that breastfeeding doesn't fail, but the systems do.
Thank you. So what you are saying, Dr. Saab, because of this, as you may be aware, as per WHO guidelines, we should have immediate, initiation of breastfeeding and exclusive breastfeeding for first 6 months. The current level of, average level in India is about 60 to 65% only. And there are states and districts where it is 30%, there are states and districts where it is 70, 80%. But average, we still have a long way to go to promote immediate breastfeeding as well as exclusive breastfeeding for 6 months, and some of the reasons you rightly highlighted. Coming back to Dr. Helai, let me introduce you. You are a consultant and with Rosewalk Rainbow Hospital. She is an MD from All India Institute of Medical Sciences and about 4 decades of experience in managing high-risk pregnancies, infertility, and minimally invasive surgical procedures. So, Dr. Helai, my question to you is from a clinical perspective, what are the key aspects of postpartum recovery that often do not receive enough attention? The speaker before talked about non-clinical aspects. We would like to hear from the clinical aspects on postpartum recovery.
Thank you. So postpartum care is the most under-medicalized phase in a woman's life cycle. We medicalize pregnancy, we celebrate delivery, and somewhere after delivery, at the mental level, we consider delivery as end point. And whatever advice and care is subsequently given, it takes a back seat in the mind of the patient's relative, and up to a certain extent by healthcare providers also. First and foremost, this mindset needs to change. We have to shift the lens from the celebration of delivery to the more broad and long-term post-delivery care for the mother and child. We give adequate treatment at the time of delivery, and we also, at the time of discharge, stress about follow-up medication and follow-up visits, importance of nutrition, importance of lactation, and hygiene. However, we fail to address certain crucial aspects of recovery. For example, we fail to address the importance of sleep and how to ensure adequate sleep for the mother, because sleep is very important for the recovery of the woman. And also we sort of ignore to, while giving advice about nutrition and importance of diet, we fail to stress upon the importance of hydration. And this is very important because in certain communities, postpartum women are not allowed to drink water. And whatever beverages are offered in the form of herbal tea and etc., sometimes it is very unpalatable and patient drinks it sparsely, and that leads to dehydration and failure of lactation and failure of recovery. Another aspect which doesn't receive enough attention by the healthcare providers is the maternal mental health, and we fail to explain the changes which takes place due to pregnancy and lactation. The process of bringing a new life into an already exceedingly difficult world can be overwhelming. We need to give some sort of cope-up mechanism to these patients and some sort of reassurance and some tools to look after the patient's mental health. And also we entirely fail to correct the metabolic storm which the pregnancy has caused. Last but not the least, we fail to emphasize on the importance of mobility and physical activity. So my suggestion is that the postpartum healthcare should be protocol driven and not patient driven, because postpartum patients, they always appear healthy when they are holding their baby, which is not a fact.
Thank you. You have highlighted important points. We go to our next panelist, and I think one of the biggest gaps, at least in my 3 decades of work on public health, maternity, prepartum, postpartum, you name it, has been mental health support. even in government guidelines, if you see, there is very little mention about, there's a lot of clinical stuff and things like that, but mental health support is always missing or is always a very big gap. And I think we have a very interesting panelist with Dr. Juhi Rachel Baluja. She is a psychiatrist and she practices at St. Stephen's Hospital. She specializes in perinatal and postnatal mental health, child and adolescent psychiatry, and anxiety disorders. Very lucky to have you, ma'am, because that's a very big gap in our programs. So my question to you is, according to you and in your practice, how common are these mental health challenges, for example, anxiety or depression, during prenatal, antenatal, postnatal care, and why are they often overlooked? Why is such a gap there?
Well, thank you, sir, for the question. Uh, we feel that there is a gap, but I'm sounding very positive here that the gap is slowly being narrowed. Now, if you look at the kind of patients which come to our OPD, now our focus is not just limited to postnatal health, but it starts from the time the woman conceives, and at any point of time we get a referral for a woman who's in her second or third trimester of pregnancy. That's where her mental health and well-being comes into focus. Now, if you look at the commonality of cases which we see, the most common ones are the anxiety disorders. Around 15 to 20% of cases which come, some of these mothers will have some sort of underlying anxiety about how their pregnancy will go, how the delivery will go. And it's not just for first timers, it's for every pregnancy, the risk continues to be the same. And beyond that, beyond the anxiety, there will be a certain set of pregnant women who will not just be anxious, but they will be they will have a depressed mood. They will have a very negative outlook despite all the support systems provided. And even a smaller fraction, which we call the red flags, are the ones which have symptoms of, unfortunately, psychosis, in which they have more extreme and darker thoughts regarding the pregnancy and the overall future of them and the baby and the family involved. So we do get a wide range of cases, and there are more numbers coming. Women are becoming more aware, and families are also picking up signs, and hence we get to see a lot of cases, not just in our outpatient departments, also from consultation liaison referrals which we get from gynecologists and obstetricians who want us to check on their patients even before they deliver. Thank you.
Thank you, Dr. Saab. I have a little difference of opinion because whenever I go to public health facilities where thousands of women line up for antenatal checkups, counseling and mental health support is one thing which is very weak. I mean, I have to admit it, maybe you may have a different experience in your hospital, but generally speaking, it's not very strong because there's a shortage of counselors, there's time issues are there, so many things, privacy issues, confidentiality. Okay, now let's move on to Dr. Rashmi Bawa. She is a founding member of WellMom. WellMom antenatal and parenting sessions, and she has over 2 decades of experience in pregnancy, childbirth, as well as breastfeeding education. So, Dr. Rashmi, I wanted to ask you, how does structured antenatal education help prepares mother and families for childbirth and feeding and all that stuff?
Thank you so much for the question. Structured antenatal education, basically I believe is the most low input but the most high yielding resource that we have. In this world of Google, there is no dearth of knowledge, we all know that. But antenatal sessions ensure that the right kind of knowledge, the right amount of knowledge is shared through the right people. I think that is very important because these days we see a lot of influencers sharing things. Again, most of them are right, but again, the amount of knowledge shared should really be very individualistic and we need to be very careful about it. In structured sessions that we have, the parents get to know about what to expect, what are the issues that they may face, and how to go by that. And when you are in the same room as people who are at the same stage of pregnancy, you get to share many things. And in fact, that also I think helps with some amount of confidence and yes, taking care of mental health. That is our small bit in that also.
Thank you. Coming back to Dr. Deepti again, early lactation counseling has a lot been talked about. How important do you think it is early lactation counsel during pre-pregnancy times and all that to ensure that, the lactation happens, properly at time and it is continued for the time it should be continued? Over to you.
Sure, I think this is one of the best questions, and I would like to answer that. Is I think preparing a mother is extremely important, of course. And having said that, but preparing the mother when the baby is already there is not the right time, because at that time, and learning from scratch is not the right time for the mother, because she's already in pain, she's healing, she's emotional also, and she's overwhelmed also, which is technically we call the postpartum phase. And so learning from scratch is not the right time. What is the right time is, and when we work with the mothers during pregnancy, it helps them to actually understand their own body. They learn, what is not normal and what is normal. And, they also learn about that how confident they can be instead of being overwhelmed. Because they now know what is normal for them and what is not. And, I want to add there one more thing is that when the mothers antenatally or prenatally are prepared, then they respond in awareness and with confidence rather than in panic. She doesn't panic when she knows that, okay, this is going to be happening with me. Okay, it might happen that, I might not get, immediately my lactation will not be there. She will not panic, but if she knows that what to do exactly at that time, or if she knows that whom to connect at that time, right? And if she has someone with her prenatally who is going to be working with her after the baby arrives. So I think these are the things very, very important. Is we all know what is postpartum. We all know antenatally it's important. But what is important is that do we really have that structure with us when we know the EDD is like another 10 days? How the mother is actually prepared for her continuity care, like. She knows who is the doctor, she knows who is the lactation consultant, and she knows when she reach home, what will happen now. So I think that is more important rather than antenatally preparing her that, okay, you must know about breastfeeding, you must know about the labor, but I think she must know about the continuity care. That will help her to step in her postpartum more confidently and joyously.
Thank you. So this concept of birth preparedness is very, very critical in India's, healthcare delivery system. Whenever it is done properly, I have seen, the outcomes are better, patients are better supported, care is family-centered, the healthcare provider is satisfied, and the health outcomes are better. So this concept should be, I think, promoted more significantly than it is being done right now. Coming to Dr. Helai again, from a non-clinical to a clinical perspective, you are a healthcare provider. So healthcare providers like yourselves and others, how can they better integrate postnatal follow-up into routine maternal care so that, early detection of complications can be done?
So this can be done at immediate planning level and long-term planning level, and at the practical level at the care provider's end. Currently, we do have some robust health programs by the National Health Mission, and one of such programs is Surakshit Matritva Ashwasan, under which the mother and child is looked after from the time of confirmation of pregnancy up to 6 weeks post-delivery. I feel if we can extend this follow-up program from 6 weeks to another 3 to 6 months maybe or longer, and at the same time introduce some sort of mandatory postpartum screening panel, and with the help of database analysis, we can identify those who are at risk, and then subsequently we can use the various digital and technological devices to approach these women and do follow up with them, and also use various health apps to educate them, and also do WhatsApp check-ins on them, and also provide some sort of basic screening for mental health and fitness programs and fitness assessment. At the long-term level, planning level, we need to definitely upgrade the availability of institutionalized healthcare provision, and we have a program for this also under the name of Lakshya, which is the acronym for labor room improvement, quality improvement initiatives. And under this, we are aiming to increase the, upgrade the infrastructure, increase the availability of modern medical equipment for further management of high-risk pregnancies and identification of it. Also, we are using systems for skill-based training, and also we are trying to use and hoping to use AI and virtual reality learning to train the paramedics and the healthcare workers. And there is a hope that we will be able to use more and more the latest wearable devices for distant monitoring and home care management. And we are also integrating the use of various diagnostic kits and medical gadgets for home-based diagnosis and management.
Thank you. Next question to Dr. Juhi. So this question is in a family. You know, there are caregivers, there's a husband, there's a lady herself, you know, pregnant lady. What kind of signs or symptoms or what kind of, you know, things the family should watch out in that lady during pregnancy or even postpartum, that they, you know, that there are some mental health issues or mental health, you know, concerns. So what should they be looking for to detect? Because they will be the first ones to be seen. She is in a family, so उनको क्या देखना चाहिए कि उनको लगे कि शायद कुछ concern and she needs some mental help.
Well, considering that pregnancy and postpartum is a very sensitive period, so many a time when the woman is going through these changes, both hormonal, biological as well as psychological, many a times the lady might not be able to pick on the signs and symptoms herself. Therefore, it is very important for family members to be on a watch or on a guard that in case anything out of the blue happens, they should report to the immediate healthcare provider. Now, for instance, if, see, motherhood is considered to be the best time in a woman's life, but if the mother after giving birth to her child does not feel so, she's sadder than usual, she's very underconfident, having low self-esteem, even despite multiple reassurances and providing a good enough support, she's unable to provide adequate care for herself as well as her baby, and she's having even dark thoughts like, you know, about self-harm and also about harming the baby, and also having extreme thoughts about life in general, and having other thoughts of hearing voices becoming suspicious. I'm talking about, these are the red flag signs that we see. So if any one of these symptoms emerge, the family should take her to the closest psychiatrist or a mental health professional and get her investigated for it as soon as possible. Because apart from these biological changes, handling these psychological changes are equally very important, and early intervention has a very good prognosis in the ultimate care for the mother as well as the baby.
Right, you are right, absolutely. You know, the symptoms which you mentioned or the signs, you know, they are very important and families should be able to detect them. And, you know, as you rightly mentioned, early detection means better treatment, early treatment and better prognosis. So that's very, very critical. Coming to Dr. Rashmi, again to you. So she talked about some mental health issues. I wanted you to broaden this perspective and sort of give us some ideas about what are the common gaps which you see, in the families, how when they prepare for postnatal phase? What are the common gaps you have seen in your practice?
That's actually a very relevant question here. Uh, the kind of postpartum support that we generally see is more baby centric, and we are all talking about that how this has to be taken from a baby centric to, I would say, a parent centric approach rather than mom centric or dad centric, because both of them are in this together. Mom थोड़ा ज़्यादा highlight हो जाती हैं because she is taking the physical brunt also of, brunt I know is a negative word, but again let's face it, there are certain changes and healing mom को ज़्यादा चाहिए. So of course it has to be a very parent centric approach. One thing is that. Secondly, what I feel is in our country, majorly जब भी हम postpartum की बात करते हैं, it is more about the preparation that I get to hear is कौन सी पंजीरी खिलानी है. Nobody talks about कि how she has to be taken care of, how the parents can be supported. Even the visitors who are coming are more, again, sorry to say this again, are more of a liability to entertain rather than helping. Nobody asks the new parents, what help do you need? The help that is offered is what is convenient to the person who's coming in. So I think we all need to be very mindful of how the parents can be supported. That is one gap that I see in normal clinical practice that I have. Another thing is that we need to work on our communications more. आपस की जो bonding between the parents, the communication between the parents takes a big hit. And they are living in their own small spaces, trying to do things for each other, but really not knowing what is working. So the communication channel, that also needs to be worked on.
I also want to add on that, in family-centered care, I think we should not be forgetting the husbands and the mother-in-laws and the father-in-laws, because in every family, especially mother-in-law, at least in my, clinical practice and public health practice, they play a very significant role in preparing for pregnancy for that daughter-in-law or postpartum, antepartum, during delivery, lactation, nutrition, क्या खिलाना है उसको, बहुत सारे decisions mother-in-law लेती हैं घर में. So I think those should also be addressed. Just only on the mother is not sufficient.
Very true, and I think that all these things should be discussed beforehand also. Birth plans are made, but even postpartum plans, they need to be worked on.
Right. So we'll go through one more round of question, but very quick answers, panelists, because we are running short of time. So first question to you: what role does family play in mother's breastfeeding and recovery journey? Very quick answers.
So I feel that breastfeeding is not only the mother's job, it's the family ecosystem, and it's deeply dependent. Mother is deeply dependent when she receives family's love and understanding and lot of support, right? We have to think about that. Is she really always encouraged, or she's questioned? She's always supported, or she's constantly corrected? That makes her feel that I can do it or I can't do it, right? And also I want to add here, I'm sorry, I know I have to be quick, but I can't resist without adding this. My mentor told me one time that, if the mother is supported, breast milk flows. If she's doubted, it slows.
Thank you. Next question to you, Dr. Gupta. In high-risk pregnancies, maybe diabetes with pregnancy or anything, placenta, so many things are there, or any precious pregnancy, what additional postnatal care measures are essential both for the mother as well as for the newborn?
So we can approach this with the acronym KAP, which is to plan this, we need to see the basic knowledge of patient about the issue and the family, and also their attitude towards whatever the issue is, and also the possibilities. What are the possibilities for them to mitigate and to self-manage? And then only we can decide what we should offer and how we should help.
Okay. Next question, ma'am. It's a public health question asking to a clinician. How can mental health screening be better integrated into maternal care?
Well, to be very short and brief, mental health screening should start from the pregnancy onwards, and also the opportunities when the mother visits the baby for vaccination clinics, namely at 4 weeks, 6 weeks, 3 months, 6 months. So these opportunities, when we do feel the practitioner feels that the mother is also having certain symptoms, there are certain questionnaires which we can check, which is the EDPS, the Edinburgh Postnatal Depression Scale, and we have the PHQ, the Public Patient Health Questionnaire 9, and the General Anxiety Disorder 7. So these are small screening tests which take about 5 minutes, and if they have a very high score, they can be quickly referred to a mental health professional in the hospital or the clinical setting where they're in. Thank you.
Maybe last question to you. It's very urban-centric question. There are a lot of parenting programs happening they have started, they are growing, especially in urban areas, in cities, metropolitan cities and all. So what do you think, are they effective, and what role they can play in making sure that, the pregnancy and deliveries and, postpartum care is, better?
The right kind of knowledge, as I already said, is very, very important, and these parenting programs do help us with that. But one thing that is much, 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 much more important is that every parenting program should not emphasize on what normalcy is. Because normalcy, the concept of normalcy is very relative with each other. सबसे पहले आता है the myth of bouncing back. I don't know from where it has come. Because bouncing back for each and every individual means something different. The concept of normalcy has to be determined. Then of course, yes, parenting programs, to just answer what you asked me, parenting programs help with giving you an insight on how things can be managed. But of course, there is no alternative to reaching out to the medical professionals in case you see anything is going haywire. Because that is equally relevant, sir. We see many घरेलू नुस्खाs going on, but जब तक hospital में आते हैं, तब तक things have already gone haywire. So to a certain limit, everything is good, but we need to have a very clear lens of where to stop. That is what I would believe.
Thank you. So, coming to the fag end of this panel discussion, I think some of the key takeaways from me, and we can have 1 or 2 questions also from the audience if they have any questions, is that it is very, maybe we'll have a question for you first. It's a wonderful session. Can you use the mic, please, so that everyone can hear?
On the government and the sector, the family, especially for the family members.
Do you have somebody directed
all are
anyone
experts.
there?
All are experts. All they knows the subject very well. The birth defect is a major issues in the world, not in India, in the world also. I have seen babies with so many defects, so beautiful, but need to awareness. Thank you.
Okay, so I'll let, then I'll come to you also, ma'am. So maybe you can give a quick answer and we'll also get her perspective.
So the answer lies in the question, why this is happening, why we have so many birth defects. So the environmental factors are blamed a lot, and how it causes these birth defects. It's not only that the exposure causes certain level of bodily damage. It is the genetic effect which different environmental factors and different dietary factors causes on the genes. There are involvement of genetics and epigenetics, which causes the birth defect. Also, our faulty dietary habits, faulty lifestyles, and also use of different modalities which has come up, and the body is responding in a different way. So correcting the lifestyle and exposure to toxins might not be that much possible, but then we have pre-pregnancy planning programs. During pregnancy, we have different diagnostic modalities like genetic tests, ultrasound screening, dietary supplementations. All these can improve and reduce further rise in the birth defects. And also, as I mentioned earlier, once these surveys are done, surveillance is done, and we have confirmed the diagnosis, more and more institutionalized deliveries and care will at least provide support for those with birth defects and abnormalities.
So you talked about environmental factors, genetic factors, intake of drugs, lifestyle changes, so many things sort of commonly, promote, they are risk factors for birth defects. There's no like a cause or effect relationship one-to-one, but these are all the risk factors. And you rightly mentioned that if there is a defect already identified through some, ultrasound or some other investigation, I think the patient must be put in a very good specialty care so that,
That is very important.
even if it, yeah.
If it is diagnosed at the test level,
Right.
so doctor responsibility to aware that
Absolutely.
this is the scene and you be prepared for that, for
Yeah.
the next steps. Thank you.
Yeah, thank you. My daughter is a radiologist, and I think she also, identifies many birth defects. And I always tell her that you should explain to the patient in a very confidential manner, because ultimately the patient has to decide whether to carry the pregnancy or not. Let not be the obstetrician be the only decider. Yes, ma'am, you wanted to say something.
Much has been said by Dr. Helai. I just wanted to add on to her information that it's not only the causative factors which are responsible for increasing birth defects, as you said, sir, but it's not that we can't do anything about it. I must inform the august gathering here that there is always a background risk of getting birth defects. Means even common population in ideal situation, some of them will have birth defects. But it's not that we can't do anything. Ma'am talked about preconception counseling. Simple measures like giving folic acid to a couple, to the mother who is planning pregnancy at least 3 months before she plans pregnancy. Simple 400 microgram of folic acid intake every day will prevent neural tube defects. So many disorders like optimization of medical conditions. Suppose there is an epileptic mother, we know that she will have folate deficiency. So these have to be given higher dose of folic acid. So mother who is planning conception should, reach to the consultant obstetrician earlier, so that optimization of her medical conditions is also done. We can't do much about environmental factors, but good exercise, optimization of weight, all these things are very, very important in prevention of birth defects. And if I am given 1 minute, I'll just like to add to what Helai ma'am said. There are certain programs, being in public sector hospital, I must say there are various government-run programs like Janani Shushu Suraksha Karikram. It provides a facility for diagnostic and therapeutic up to 1 year of birth. So, ma'am, that is a very, very good program. I know I'm talking to a very elite class of people here, but for a common man who can't afford, this provision is also there. Then there is Janani Suraksha Yojana. It gives monetary assistance to mothers who have delivered in institutions. So in a way, it promotes institutional delivery also. Then universal immunization program. And what I think was missed in the panel discussion was giving contraception during postpartum care. That is a very, very important and
strong pillar of postpartum care. So she should have good interval, inter-pregnancy interval according to her reproductive intent further. Thank you so much for giving me.
Thank you, ma'am, for your inputs.
Add one thing here, sir. I truly understand, and just, it made me feel to say this, that you talked about contraception, but I also want to add here, if the mother is breastfeeding, it is a natural contraception for her, right?
It's okay. I think we can have this discussion offline during lunchtime. Any other question from the audience? Yes, ma'am. Can you get the mic?
Going on since ages.
She's far away, so can somebody give the mic to her? Maybe, I will request times to keep a session on fertility control in the next session whenever they have, next. Yes, ma'am.
Yeah, I have a question for Deepti ma'am. So in what situation would you recommend alternates to breastfeeding?
Absolutely, alternative methods of breastfeeding is possible. When, number one, the low milk supply actually is rare, right? We have a lot of methods and clinical ways to help the mother and support the mother. But if it is really there, right, it could be, if it is something, let me bring up some cases, like if there is a breast surgery or the mother is obese and, not able to actually feed the baby. First line of action is always breastfeeding. But if it is not working, we can go ahead with the expressed milk. If, let's say, mother is not able to express also, due to any condition, due to any reason, right? The mother is not able to express enough for the baby, I would say, right? Then the donor milk is available. And if I would say that if that is also not available in your vicinity, then absolutely the expressed milk can be given through cup feeding or katori chammach. These are all alternative methods, right? And even that is possible. And if it is medically indicated, top-up milk supplementation is also possible, but that's not the first line of action, right? I hope I have answered. And if you have any question, please.
No, I mean,
Yeah.
it sort of comes from my own experience. So,
I understand.
like I had to stop breastfeeding at 4 months because I have asthma and I had to take my medication. So there are, situations like mine, I'm sure, which are like medical. And, you need to go to alternates, which are, not advisable by doctors normally.
So you did breastfeed
For
your
4
baby?
months, yeah.
Oh,
but I had
beautiful.
to stop early because I couldn't breathe properly without my medication.
Did you try any alternative feeding methods?
So I did pump, but I had to actually stop because I wanted to take medication myself, so it would affect the milk. So I had to stop, even pumping because I couldn't give that milk anyways. Yeah.
I'm sorry to know, but I think there are many compatible medications, but I'm not sure what you had taken. But in any case, unless and until it is high critical and challenges with the mother, breastfeeding is possible in every case.
Thank you, ma'am.
Thank you. Can we?
Or,
Can
or
we,
probably on
wait,
TB.
wait. Can we have the lady to ask a question? That भैया उनको माइक दे दीजिए थोड़ा. No, behind that one. I'm glad there are some questions from the audience because we should discuss about this, Otherwise, अगर हमारी problem solve नहीं होगी or at least we don't get some better information, there is no use of having, all these discussions. Yes, ma'am.
Thank you. Yeah, I'm not asking a question. As a lactation expert and being in this field for the past almost 18 years now, this lady who just had a question. So alternative methods, yes, could be donated breast milk. There are a lot of donation banks which are available.
Breast milk banks are there.
Yes. And also, if she was on antihistamines, probably because of her asthma, she could have still continued with her breastfeeding. But of course, maybe lack of support, lack of guidance, maybe made her stop breastfeeding her child after 4 months. So actually, as ma'am said, that only cancer drugs are contraindications to a breastfeeding mother. Any other medication, in fact, when you're taking any other medication, if you have asthma, if you still continue to breastfeed your child, you will still be able to produce those highly immune boosting, nutritional breast milk that goes to your baby. So your baby would definitely be stronger. So I would recommend all breastfeeding mothers, don't stop breastfeeding. There are a lot of ways, there is a lot of help, and there is a lot of support. Only lack of support makes mothers stop, do not allow them to nurse their child at least 1 year to 1.5 years. Thank you.
Thank you so much.
Thank you for your input. I think we need to come to close of this session now. I want to thank all the panelists for a very interesting and very insightful discussions. Very different, diverse viewpoints have come in. It's not very clinical. It talks about family. It talks about mental health. It talks about lactation, counseling, pre-counseling, how should we support the mother, how should the system work. So it's been a very interesting session. At least for me, there's been a lot of new lessons which I have learned. I hope the audience also got some new information. Thank you very much. Thank you.